This is a 38-year-old woman, another person who fell down steps. There seems to be a lot of that in foot and ankle injuries. Um, Starting again with the bones. So here we can see edema with a little fracture at the anterior process of the calcaneus. There's also a little bit of edema with an undisplaced fracture at the navicular tuberosity and some edema at the medial talus. So these fractures and contusions involve our Chopart joint, which consists of that talocalcaneo-navicular joint and the calcaneocuboid joints. So just as we did on the prior cases, we thought about the bones. Now let's think about the ligaments that attach to these bones. So the ligaments that stabilize the Chopart joint, let's start by thinking about the calcaneocuboid joint. So that is stabilized principally by the dorsal calcaneocuboid um, ligament, and then the short and long plantar ligaments, as well as the calcaneocuboid component of the bifurcate ligament. So our little fracture at the anterior process of the calcaneus is at the expected attachment of the bifurcate ligament. Further laterally, we have the calcaneocuboid component, and then more medially, you have the calcaneonavicular component. So those are both attaching on our fracture fragment. And then as we look at the long axis images at the dorsocalcaneocuboid ligament, you can see that that's also a little bit thickened and edematous, compatible with injury. The talonavicular or talocalcaneonavicular joint is stabilized by your dorsal talonavicular ligaments and spring ligaments, as well as the calcaneocuboid component, calcaneonavicular component of the bifurcate ligament. So here, talonavicular joint capsule, dorsotalonavicular ligament looks edematous, irregular, compatible with injury. We already talked about that calcaneonavicular component of the bifurcate ligament. And then we'll talk more about the spring ligaments in the next case. But there are three major components, the most important being your supromedial um, component of the spring ligament. That looks like it's intact here. And then we have our medial plantar and infroplantar longitudinal components of the spring ligamentous complex. That medial plantar oblique component looks like it's attaching in the region of that navicular fracture. Um, Altogether, these findings are compatible with a midtarsal sprain injury. This is a common injury pattern that's going to result from ankle inversion. Commonly, clinically, it can get confused for your typical ankle sprains. Treatment of these injuries is usually conservative, but it's important to identify and know these structures so that you can look for the other injuries that you might expect when you see one of the ligaments or fractures. Um, and important for the patient to know, I think, why exactly they're hurting, even though most of these injuries are treated conservatively.